Hello everyone, and welcome back to Introduction to Orthopedics. And in this video series we're going to cover the bones, ligaments and musculature of the shoulder. And this includes the glenohumeral joint, the acromioclavicular joint and the sternoclavicular joint. And these three bones primarily make up the shoulder girdle itself. So we're just going to start by covering the first long bone, which is the humerus. And between the humerus and the scapula we have the glenohumeral. So we're just going to take this bone out and isolate it for a moment. So the first thing to note, when you look at the humerus, that it's a long bone, and at the head at the top we have a round articular surface covered in healing cartilage. And in another video we've covered the distal end of it, which would be part of the elbow joint. And we have some other kind of important landmarks. So we have the greater and lesser tubercles, and this grey line here represents where the bicipital groove would be, where some musculature passes through, which we'll cover in a moment. The next bone we're going to look at is the scapula, or our shoulder blade. And we can see right here where the humerus articulates in the glenoid fossa. We have our coracoid process here. We have our acromion here. Superior border, medial border, this is superior medial. We have the inferior medial, and we have the lateral borders, and then we have the spine of the scapula here. We also have a little hook here, a little kind of a crevice here in the bone. It allows one of the musculature from the throat to pass through and attach directly onto the scapula. So the next bone that we're going to cover is our clavicle or our collarbone. We'll just have a closer look at that. And you'll see it's a slightly S-shaped bone, and it articulates on the lateral aspect of the acromion and on the medial aspect on the sternum. So the sternum side would be the sternoclavicular, and on the lateral aspect we have the acromioclavicular. Now, to cover some of the ligamenture, we're going to delete the ligamenture as we're going through. So first, we have a sternoclavicular ligament, which attaches the sternum and the clavicle. Mostly ligaments are labelled after the two primary bones. Our next ligament on the lateral aspect is our trapezoid. Our next ligament is our coracoid ligament. Our acromioclavicular ligament. And here, coracohumeral ligament. You'll notice a little piece here, and the transverse humeral ligament, and it's responsible for holding the long head bicep in place, which we'll cover in a moment, in the bicipital groove. We have another ligament just sitting under here, coracoid ligament. And that's mostly, we have actually one at the back, so we have one more here, is our inferior glenohumeral ligament. Now that's mostly all the ligamenture of the shoulder. There's not much holding the shoulder in place, with exception to the articular capsular structures and the musculature. The ligamenture primarily connects between the collarbone and the scapula. So here we have the articular capsule. So underneath here, we're going to look at two more little structures. So we have the superior glenohumeral ligament, and our middle glenohumeral ligament. These are some of the minor ligaments. They don't get injured too often. So now we can see that we have our scapula, which is primarily a flat plate against a relatively rounded surface of the humerus. And we can see how they all articulate together. And next, we're going to add the musculature, and we're going to work back through that. So the first thing we notice we have on the outside, we have the deltoid, which is the big bulky muscle that sits around the anterior, lateral and posterior of the shoulder. So we have our anterior deltoid, which attaches to the first third of the clavicle and onto the deltoid tuberosity right about here on the humerus. So I'm going to hide this. We have our lateral, which covers a portion of the clavicle and the scapula itself onto the same deltoid, or onto the same tuberosity. And we have the posterior, which again attaches to the same tuberosity, but this time onto the spine of the scapula. Now if we stay to the front just for the moment, and take some of this musculature out of the way that we're not going to be talking about. So on the front, we have primarily the shoulder flexors and abductors. They also work as internal rotators as well. So most of the muscles in the shoulder, it's quite complex, have combinational movements. So we have these three portions here of the pec, superior, medial, inferior portions of the pectoralis major that attach on to the lateral border of the humerus. The superior aspect attaches onto the collarbone or clavicle, medial onto the sternum, and the lower portion down onto the ribs. So we hide these. Now just a muscle to note that's not mentioned very often is this little guy here, and it's a sternalis, just the lateral aspect of the sternum. Just to note. Now here we have the pectoralis minor. So the difference in the attachments is this attaches, as we mentioned earlier, to the coracoid process of the shoulder blade directly down onto ribs 3, 4 and 5. So that primarily clears most of the musculature from the chest directly across onto the shoulder. I'm just clearing the aponeurosis and fascia out of the way so we can continue. So what we're going to cover next are they're part of the shoulder flexors. They're primarily elbow flexors, but they do cross over the shoulder joints, so we cover them in this as well. We have the biceps brachii, long head on the lateral, medial. We have the short head. Now the long head, you'll notice, as we spoke earlier, travels up through that bicipital groove underneath the little stitch that I didn't delete on purpose. Here it is here. Now we're going to take it away. And now we have the long head bicep that attaches onto the superior aspect of that fossa that we spoke of earlier, the flat plate fossa on the lateral border of the shoulder blade. So here we have the biceps brachii short head, which actually attaches onto the lateral aspect of the coracoid process. Now the medial aspect on the forearm attaches onto the aponeurosis about 1/3 down or 2 to 3 centimeters down on the forearm, whereas the lateral or the long head bicep attaches onto the radial tuberosity on the forearm. Now here we have our coracobrachialis, which attaches again onto the coracoid process, but this time onto the medial aspect of the upper humerus. It's also a shoulder flexor. Now, just to note, but it's not important for shoulder flexion because it's not involved in it. Just here we have our brachialis, which is involved in elbow flexion. We'll just take it out of the way for now. Now, some of the other structures to note are the bursae. So we have our subcutaneous acromial bursa, so subcutaneous just under the skin. Doesn't get injured very often. The same with the subdeltoid bursa. We don't see injuries in that very often. They can, but we don't see them very often. The one we normally see is the subacromial bursa, because it generally gets pinched between the head of the humerus and the acromion. Now we have some other small bursas that we're not going to discuss today because we're here for general anatomy. Now the muscle we see here is our subscapularis, and we're going to talk about that in a moment. We're not going to discuss this little guy here, subclaviculis. So we take this is our lats, that's fine. So as we go back onto our subscapularis, so we'll discuss that in a moment because we're going to cover that in a section on its own in a moment in our rotator cuff description. Okay, so on the back portion we have our long head tricep, our lateral, and our medial is in there as well. So here we have lateral head of the tricep. These are elbow extensors, but this muscle here in particular, the triceps long head, is involved in shoulder movements because it primarily articulates off the inferior or lower part of the flat plate that we spoke about earlier on the shoulder blade. And here we have our medial head, and we're just removing that out of the way. This discussed in a different video. Now we're going to clear the superficial muscles from here. We have our upper trapeze, which is involved in shoulder elevation. So it attaches across the border of the spine of the scapula and across the first third of the clavicular collarbone, the lateral aspect, and then traverses all the way down to T12 from the occiput at the base of the head. We're going to remove this. It's commonly known as the shawl muscle. Here, involving in shoulder blade movements for shoulder retraction, we have our rhomboids major, rhomboids minor. We're not going to discuss all the spinal attachments, but in relation to the shoulder and the shoulder blade, it attaches onto the medial border of the scapula. We remove those. So serratus posterior superior, we're going to hide that. We're not going to discuss that one at the moment. Levator scapula we will mention. So levator scapula is here, but we have to clear these out of the way first. They're neck extensors. We just take them out of the way. So this complex of muscles that we see here are attaching onto the superior angle of the medial border of the scapula, and they traverse all the way up through to the upper cervical segments. And they're involved in neck extension and shoulder elevation. Okay, now the muscle we spoke about earlier that actually attaches to that little hook portion of the shoulder blade is our omohyoid, which you can see actually connects all the way through to the throat and to our hyoid. So this can actually affect your throat, and your throat can actually affect your shoulders. Quite interesting. So we're going to remove that. Now, the next group that we're going to discuss are the rotator cuff muscles. So primarily on the back end, we have our external rotators, and on the front end, we have our medial rotators, or our internal rotators. But for now, we have our supra, infra, teres minor, teres major. So our supraspinatus sits in the supraspinatus groove and attaches on the upper lateral border of the humerus. Our infraspinatus sits in the infraspinatus fossa and attaches on the lateral posterior portion of the upper humerus. Teres minor attaches on the lateral border of the shoulder blade itself and attaches onto the posterior lateral aspect of the upper humerus. And our teres major, even though seen here, looks like it's attaching on the medial aspect, actually attaches on more of the posterior aspect and is involved in external rotation, but also adduction towards the body. Now, the next group of muscles, we have removed some already. So we spoke about our pectoralis major, our pectoralis minor, and what we haven't removed yet is our latissimus dorsi and our subscapularis. So this is our subscapularis, and it sits between the shoulder blade, right between the shoulder blade and the musculature and the ribs. So we'll just remove it. So this is our subscapularis muscle. You can see how it attaches onto the anterior aspect in the bicipital groove. It pulls across this way, which involves an internal rotation of the humerus. Now we're just going to remove these guys out one more time. Because I just want to show the pectoralis muscles, as we spoke about, part of the internal rotators. So this is the pectoralis muscle. So it attaches onto the front and is involved in internal rotation. So we're just deleting them out. They're part of the internal rotator group. Pectoralis minor. Now the next two that we're going to talk about, like we talked about our subscapularis and our latissimus dorsi. We're just going to get back to those in one moment. Okay, so our subscapularis as we said a moment ago, sits on the anterior of the shoulder blade. And this is it here. And it's involved in internal rotation, along with, it's quite complex when you look at it all together, our latissimus dorsi, which we haven't mentioned yet, which is actually the big heavy lifter, big muscle on the back. Touches all the way down to your sacrum, across the iliac crest, up roughly to T7, all the way across. It inverts, so as you can see here, the inferior portion here flips and is attached to the superior aspect of the internal on the bicipital groove, and the superior fibers move across and invert and attach on the inferior part on the bicipital groove inside the shoulder. We'll just take a closer look at that. And that's that attachment. So these are the inferior fibers and these are the superior fibers. And what that does is it actually allows the teres muscles to move across and attach comfortably onto the humerus. So just before we finish, one of the things that's important to note in relation to the shoulder kinematics or mechanical movements is that when the arm abducts to 90 degrees, which we're going to demonstrate in a moment, the shoulder blade abducts roughly 30 degrees laterally, and the collarbone generally superiorates a little bit and rotates posteriorly approximately 20 to 30 degrees, which we're going to demonstrate in our next video. So what we're looking for here is, just as we spoke a couple of moments ago about the relationship between the humerus in lateral abduction out to the side and the scapula moving across the ribs, and our combinational movement of our collarbone superiorating and rotating back roughly 30 degrees. This is just a video to exemplify those movements. So we can see as the arm laterally abducts, we have lateral abduction of the shoulder blade or scapula. And we're roughly looking for a 30 degree lateral abduction. And what we also see is a slight superioration and a slight rotation back of the clavicle or collarbone. So that's the shoulder joint. So I hope you've enjoyed the video, and we'll cover the general movements of the shoulder in a different video.